Hello, and welcome back. In chapter 12, we're talking about 12-step facilitation and treatment. Now, the 12 steps or other self-help groups and programming are really not of clinical matter because clients can benefit from utilizing these programs themselves without the presence of a clinical provider, and also um, peer support providers or peer support workers can also provide facilitation of 12-step facilitation and treatment, as well as self-help groups or whatnot. But these are very beneficial to addictions treatment. So the primary focus of self-help groups is to provide emotional and practical support in exchange for information, right? Such groups use participatory processes to allow people to share knowledge about common experiences and issues. AA was founded on June 10, 1935 by Robert Holbrook Smith, a physician, and Bill Watson, a failed Wall Street stockbroker. The plan for the group was devised by the two men who shared the aim to spread supportive messages to the sobriety to other alcoholics. Early members decided to write about their struggles to achieve sobriety in order to share the discoveries with others, leading to the principles of the now well-established foundation. The first edition of Alcoholics Anonymous was published in 1939, detailing the well-known steps and traditions. Other groups we have are Al-Anon, founded by the wives of AA members, is a support group of the family of someone who's struggling with alcohol use disorder. Codependence Anonymous, right, is founded in 1986 in Phoenix, Arizona. This is a 12-step program that strives for healthy relationships from the point of departure of codependence and someone with an addiction. Narcotics Anonymous (NA) is in 1953 is a self-help group pattern after AA. It was founded and called itself Narcotics Anonymous. The language of AA speaks to alcoholism and NA speaks to addiction or chemicals. Alateen by 1957 is a response to the recognition of teenagers presenting special needs and concerns, right? Rational Recovery, RR, was founded in 1986 by Jack Trempey and emphasizes direct instructions for recovery addicts on self-recovery and permanent abstinence from addiction. Secular Organization of Sobriety, SOS, was founded in 1988 by James Christopher, who had attended AA meetings. Moderation Management was established in 1994 as a free of charge nonprofit support group that welcomes those concerned about their drinking, regardless of the level of consumption they have. Smart Recovery is an abstinence-based nonprofit organization promoting and managing self-help programs for people having problems with drinking and using. So the group work process with how the 12 steps work, right? So goals: abstinence from alcohol or other drugs, steady employment, stable social relationships, positive physical and emotional health, improved spiritual strength, adherence to legal mandates, requirements, and as applicable. The 12 steps and 12 traditions. AA pioneered the 12-step model from which other 12-step programs now operate. Each group has an AA is supporting self-supporting, non-for-profit, not-for-profit, and corporation, but with not affiliated with the professional community. All AA groups are guided by the 12 steps and 12 traditions. There are 6 noted types of 12-step meetings: open, closed, discussion, speaker, step, and AA Big Book. Among the varieties of group counseling, there's an enormous diversity in format, goals, and the role of the leader. There are many ways to select the members of the group. So 8 characteristics for a group success. Members have shared experience in the case that their inability to control their drug and their alcohol use. Education is a primary goal of AA membership. Self-help groups are self-governing, and the group process emphasizes on accepting responsibility for one's behavior. There is but a single purpose to the group. Membership is voluntary. The individual member must make a commitment to personal change, and the group places emphasis on anonymity and confidentiality. A sponsor is a more experienced person in recovery who guides the less experienced sponsee through the program. Level 1 sponsorship is concerned with sobriety. Level 2 sponsorship, the sponsor counsels the sponsee through the 12 steps so that the recovery can be achieved. Fundamentally, the sponsor has the single purpose of helping the sponsor recover from their behavioral problem um, brought through suffer into 12 step work. The focus on relationship, both sponsor and sponsee, is the 12 steps, with the sponsor serving as a guide and facilitator to the recovery process. So, there's always been a question: do the 12 step programs really work? They have a long and successful history in the field of chemical dependency treatment. Researchers have found that participation in the 12 step groups has associated with positive outcome among substance users, and the involvement in 12 steps self help groups is associated with reduced substance use. Some of the advantages we look at: self help groups are self reflective, self selective. Certain dynamics that can facilitate personal growth are more likely to exist in groups than an individual counselor. And group settings offer support for new interaction dynamics and encourage experimentation and behavior rehearsal. Participants are able to explore their style relating to others, the predictability, consistency, and the universality of it. The group's ability to provide free, long-term, easy access to exposure to recovery-related common therapeutic elements. And they are free. Let's talk about some of the disadvantages of the 12 steps. So it's unclear just how many people respond to self-help groups. The effectiveness of 12 help groups may be limited by attrition rates, and low participation. Some members do not attend consistently, and there's little empirical research into what elements of this or the 12-step programs are effective. Not all people are suited to be for all groups, and the screening process for self-help groups is limited, and in most cases, especially in open groups, non-existent, and there is no trained facilitator. A strong point of resistance to the incorporation of self-help groups is into treatment by counselors is based on the fact that many groups operate from a foundation of Christianity. The emphasis on spirituality, surrender of powerlessness, contradicts contemporary and dominant Western culture norms and self-reliance on widespread secularism. When AA was founded in 1939, Christianity was the dominant faith practice in the United States. Since then, there has been a social shift and increased acceptance of alternate belief systems among Americans, and a subsequent increase of clients who do not strictly identify as members of an organized religion. For females or clients identified as non-binary, it may be difficult to identify with religious-based language that may be interpreted as sexist or oppressive from a dominant cultural standpoint. Counselors may choose to refrain from Christian foundation of AA, addressing directly the reference to God and as exchangeably with the higher power. 12 steps programs, in addition to supportive medical follow-up visits and appropriate use of medications, if needed, may greatly increase the probability of success of sustained recovery. And traditional intervention strategies used in chemical dependency programs frequently include a combination of individual and group counseling, education lectures on drug use, 12-step assignments, and self-help groups. So the role of a counselor. Counselors not only have significant influence on clients' attitudes towards 12 steps, but it may also be concluded that clinicians' practices are critical to client outcomes. Counselors have an important role in educating clients about self-help groups, including addressing the misconceptions and concerns, suggesting particular group meeting formats. So again, counselors shouldn't frown upon self-help groups or 12-step programming. Educating clients on how to do that to sustain their recovery once they finish treatment is really important. Treatment is a long-term process, and recovery is a long-term process. And when treatment ends or whatnot, we want to make sure that clients can continue their recovery, right? I often tell my clients that are in treatment or whatnot, when you're in treatment, you should hang around people that are in recovery or in 12-step programs or in self-help groups or whatnot, because those individuals have that experience to help guide you. But when you hang around with others that are in treatment still or whatnot, you're hanging around with an individual who is still struggling with the cravings and still struggling with the lack of coping skills to actually sustain their recovery, right? So finding self-help groups and individuals that are in recovery can be very beneficial to clients. So suggestions for counselor providing care. When making a referral to a self-help group or determining whether to incorporate a group into treatment, the counselor needs a list of all available self-help groups in the client's community. To address clients' initial resistance to groups, making Alcoholics Anonymous easier was developed to equip clients to deal with the experience they are likely to encounter in AA meetings, so they will not immediately reject AA as a potential source of help. Counselors should take note if the client objects to attending groups near his or her home and nominee reasons, in which case it is the counselor's responsibility to provide alternative groups. Counselors need to make it clear that neither confidentiality nor anonymity can be assured in that process. And consult with colleagues. Read and stay current on research, and contact organizations and attend available groups to get informed about those groups.